morning, everybody. Cool. I think we can start. Welcome, everybody. Good morning. Today we will talk about healthcare for Slovak cancer patients. I'm sure you know all about it. Some technical information first. If you need translation, these are the devices that are meant for you. There's a channel 1 and 4. 1 is for English, 4 is for Slovak. Prosím, ak potrebujete tlmočenie, staničky sú pri dverách. Kanál 1 je pre angličtinu, kanál 4 pre slovenčinu. So, we will talk about the main topic, how to improve care for patients, and in the end save many more lives than we do. Please welcome 4 leaders that will welcome you here, that will give the keynote speeches. Štefan Korec, the chair of Onco Alliance Slovakia. It's up to you. It's up to you.
One, two, three. Up, down.
Raz, dva, raz, dva.
Raz, dva. Well, good morning, everybody, dear friends, dear colleagues. I think friends are, the saying friends is more appropriate because I think we all are friends here, trying to help cancer patients, trying to improve the quality. It is a great honor to welcome you here. I am both humbled and excited to talk to such an assembly of experts from abroad, local experts, patient organizations, physicians, organizers, politicians. I think it's a historic event that we have assembled, or that we succeeded to assemble such a group of people who should help, who should hopefully come up with not only with a real assessment of situation, but with a recommendation for further steps. I'm hoping that we can learn from each other's successes, how to avoid mistakes, and in the end, I'm hoping we can tell our patients jointly we can do it, jointly we can succeed. So let's start. Thank you very much for coming.
Štefan Korec, thank you very much. And now Vladimír Šucha, Head of European Commission Representation in Slovakia.
Ladies and gentlemen, good morning, everybody, and on behalf of European Commission, warm welcome to this event. You know that for European Commission, and particularly for the Commission of Ursula von der Leyen, the fight against cancer is very, very high political priority. There are 10 points in the action plan to fight against the cancer. Stella Kyriakides, the Commissioner for Health, she on her own, in her own personal capacity, she is one of the biggest fighters against the cancer in the European Union. She was here, she visited Slovakia back in December, and she passed and left this message that the European Commission stays with Slovakia and with all people who are trying and going to fight against the cancer. You know very well that the cancer represents 26% of all deaths in the European Union. That's why there is this impetus, there is this pressure on fighting against the cancer from the research point of view, but also from the diagnosis, treatment, and also the working with the patients, working with those who survive the cancer. Here in Slovakia, there are few particular challenges. I'm not going to talk about them in depth because I saw in the agenda that you have this oncological profile of Slovakia, which was actually presented by the Commission and OECD a few months ago. You will have the in-depth presentation, but it's just to tell you that this is for the Commission high priority, and the Commission, with all its limited powers in the healthcare, as you know, the European Union does not have full capacities in the health, but this is something we need to use, and we are ready to use it in full. Just to tell you that it's, in my past, in my previous function in Brussels, I was very happy to be one who was laying down the foundation of the Knowledge Center against the fight against the cancer. It was in Brussels, and this is one point in the 10-point action plan of the European Commission. Just this morning, I was listening in the podcast driving to my office. You know how many scientific papers are appearing every day about the cancer? So it's 2,300 scientific papers every day. So then, well, it was the podcast was all about the use of AI in the healthcare, and in particular in the fight against the cancer. So I don't think that without artificial intelligence and with all these technologies, we are able to fight this tsunami of data knowledge which is hitting us. And I think just to navigate in this, we need also the new technologies. And I'm very, very hopeful that the healthcare is exactly the field where the AI is already now helping. And I'm sure that very soon, maybe in 1 or 2 years, almost every doctor, every practitioner will have AI helper with him or with her to help them to help the patients. So again, very happy to be to have you here and to stand with Slovakia and dear minister. Whatever you need, this was also the message to the previous minister from European Commissioner, and she is very much willing to help Slovakia with all powers the Commission may have. Welcome and have a successful 2-day event here in Slovakia. Many thanks.
Thank you very much. Vladimír Šucha. And now Mike Morrissey, Chief Executive of European Cancer Organization. The floor is yours.
Well, good morning, everybody. Lovely to be here. As I was saying to the Minister just a moment ago, we're super excited at the European Cancer Organization to be here. It's our first ever national parliamentarian visit. We work mostly with Vladimir's colleagues at the European Commission in Brussels. So it's a big step for us to be here in Bratislava, to be supporting this event and our friends at Onco Alliance. We are a federation of organizations, European organizations, that represents oncologists, nurses, pharmacists, and patients together. And the European Cancer Organization believes that it's only when you've got everybody involved in oncology that you can make good decisions. And we are pleased to be here because we believe that Slovakia is one of those countries that is taking seriously the implementation of Europe's Beating Cancer Plan. So in 2020, Ursula von der Leyen, the President of the European Commission, announced the start of a consultation for Europe's Beating Cancer Plan. A big change from what had happened before in the Commission in terms of the approach to healthcare. And of course, this was around the same time as COVID was starting. But a huge political investment, a huge financial investment in reducing inequalities in cancer care across Europe. Why is it that somebody living in Bulgaria doesn't have access to the same treatment as somebody living in Germany? We're all in the business, I believe, of reducing inequalities in cancer wherever they exist. Some of them are geographic, some of them are not. So we're excited to be here because we want to stand up for reducing inequalities, but not by complaining, but by being constructive, by trying to find ways, trying to find examples of this worked in Sweden, or this worked in the Netherlands, or this worked in Romania, or this worked in Slovakia, and exchanging that information across borders. And it's through events like this, I believe, that we can have that exchange and we can make those improvements. I'll be talking a little bit later about some of the data that we have. We are an organization that brings people together, pulls data together. And what I'm hoping is that many of the people in this room can help us improve the data that we have on inequalities, so that by having the right data, we can make the right improvements. So looking forward to a very interesting program today. And me and my colleague Ricardo here are here to answer any of the questions you may have, or if you want to get involved in our organization, you're more than welcome. Thank you very much.
Thank you. Now the last speaker in the opening remarks, Andre, I hope I pronounced it right, Carvalho. Is it good? Senior Scientist of International Agency for Research of Cancer. Thank you.
Good morning, everyone. For me, it's an honor and a privilege to be here today. I'm representing the International Agency for Research on Cancer, the WHO specialized agents, and I'd like to thank for this invitation and applaud the event organizations and Onco Alliance, the Minister of Health of the Slovak Republic, the European Commission, the European Cancer Organization, the Parliamentaries for Cancer Action. We are here by a request from the Minister of Health to the European Commission that's funding the project that we are developing here on improving cancer care coordination, mainly related to cancer screening, the process and the communication on cancer screening. But we will not achieve the impact on improving cancer screening if you don't talk about the whole cancer care continuum, from primary prevention, from awareness in the population, from cancer care in terms of treatment, because if we're going to bring patients early on with cancer diagnosis, we need to give proper treatment and the quality of life for the cancer patients that got treatment. So it's again a privilege to be here to discuss how can we improve the quality of life and the quality of care of cancer patients in the Slovakia Republika. Thank you so much, and let's enjoy those 2 days of event.
Thank you very much. And as Vladimir mentioned, it should be, and I hope it is, high political priority, and that's why we have the Minister of the Health of Slovak Republic, Michal Palkovič. The floor is yours.
Thank you. I have to put the mark so that you know who I am. Okay. Good morning, distinguished guests. It's a privilege, although I am not a politician. Thank God. I am a professional dealing for a whole of my life with cancer patients, as I am a clinical pathologist. And now I am taking the ship of the Ministry of Health towards rough seas, but nevertheless in the fortune of having a calm seas ahead of us. I am really grateful and thankful for the presence of highly ranked scientists from the Onco Alliance, European Commission, and the IIRC that will help improve the projects we already started in the Ministry of Health, and improve not only them, but mainly start and proactively take over some of the initiatives that you already have, the wisdom and the knowledge that we really need. I will not talk about the outcome of I would really use the word of oncological pandemic that we face in the world. It's not an isolated issue. We all know that the mortality is high, especially in our country. And that's the reason why we need to target this issue very seriously, with a systematic, with initiatives, and with the help of respective scientists. We are hoping to fight the cancer spread as much as we can. Ministry of Health is now committed to promote and, of course, implement major initiatives from our national plan to fight cancer, with the Europe's Beating Cancer Plan and international recommendations. I will not talk too much of the things that we start or we will start. I would maybe more focus on the priorities that we have nowadays. and that is the awareness or the strengthening of the awareness and education of the public. This is not only in the prevention of HPV, but also in the initiatives that we have in the data collection, and that is the OncoAssist program, which we push forward these days. And I will, from this highly ranked event, go into the parliament and try to push forward laws that enables us to fulfill one of the tasks that we have in the data collection, which is extremely important in order to make good decisions. The other thing is ensuring equal access to most innovative therapies, but as well as to most innovative approaches to cancer treatment. Then strengthening of the capacity of healthcare personnel in order to understand the approaches and the methods of palliative care and oncological care in general. Then supporting research and cooperation. This was one of the main issues that we as a government of professionals have issued in our decree of government, that we will support and we will strengthen the widespread cooperation, not only with the European Commission and WHO, but also on non-government organization as well. So with all of these already said by my 4 speakers, I am really keen to have the all guidelines and endings that you will come forward. Thank you for your being here, for your attention, and I wish all the success for this conference. Thank you.
Thank you very much. Michal Palkovic, Minister of Health of Slovak Republic. Thank you for your time. I think you have a busy schedule, Minister, so you have to leave, right? Yes. Thank you very much. First, we have to evaluate what Slovakia, how many problems Slovakia has. So that's why we will talk about the Slovakia country profile. We know that we face certain challenges in providing healthcare for cancer patients. Please welcome again Mike Morrissey, Chief Executive of European Cancer Organization, and Riccardo Moschetti, hope that I pronounced it right, Policy Officer of European Cancer Organization. They will talk about Slovakia country profile.
Thanks very much indeed. And it's me again. We're going to be talking about, and I think we've got some slides here, have we? Yeah. Is there a clicker or something? Yes. Ah. Great, thank you very much. We're going to be talking about the European Cancer Pulse, which you can find at europeancancerpulse.org. We're going to have copies of this available at the back a bit later for you to have a look at. But first of all, let me just explain what the European Cancer Pulse is about. This is all about tracking inequalities in cancer wherever they exist. And as I said earlier, sometimes these inequalities are to do with gender, sometimes they're to do with geography, sometimes they're to do with your income. There's lots of inequalities that exist in cancer care. And what we were asked to do was to come up with a tool that my mother could understand and my mother could use, which is available to demonstrate where those inequalities exist. And we think it's important that we do that because without demonstrating where the inequalities are, it's very difficult to try and fix them. And you can see in one place other people's data on inequalities. So this is not the European Cancer Organization's data. This is data from all sorts of data sources put in one place. Now we know that data, the quality of data is extremely important and we want to continue to improve the data that we have. You may be aware of data that is not in the European Cancer Pulse, and if so, we'd love to hear from you because we want this to be as effective as possible. Now this is not the European Cancer Pulse is not, like in football, a yellow card or a red card from the referee. That is not the purpose of the Pulse. The purpose of the Pulse is to measure progress, to show improvement, so that the public can see where a particular country, where a particular region is in terms of its position on cancer inequalities. So this is a tool that is meant to complement the EU's Cancer Inequalities Registry. It includes the data from the Cancer Inequalities Registry and our friends at OECD. And it's about highlighting gaps where we don't have data and demonstrating areas where of inequalities where we do have the data. And it currently includes 34 countries, so not only the 27 countries of the EU, further afield than that, 120 data measurements, and 20 categories of inequalities are included. And by country, if you go to europeancancerpulse.org, you can select a country and then you can choose the inequality that you want to review. And this year we're going to be improving it. Actually, next week we've got a big meeting with friends from IARC attending, friends from the Joint Research Centre and the EU Commission, friends from WHO, OECD, coming together to see what we can do with the Pulse and how we can better use the Pulse to track inequalities in cancer. So we're going to be looking for more data. We're going to be having this workshop, as I said. And this is about using data to influence decision-making. That's the whole point of the Pulse. Now, this is the first time we've done this for a particular country. And as I say, Ricardo will have copies of this available at the back. And it's to try and demonstrate, based on the data that we have in the European Cancer Pulse, where Slovakia sits on various issues. And here are some of the highlights that you can see in the European Cancer Pulse. The mortality in Slovakia from cancer higher than the average for the European Union. Some good news, the HPV vaccination, we were just talking about this with the minister this morning. HPV program for both girls and boys, which is a very effective way of reducing the burden of cancers, the many cancers caused by HPV virus. Slovakia has a program for boys and for girls. You can see that here, the dark blue is the EU average, and the light blue is Slovakia. And you can see that in cervical cancer and colorectal cancer screening, Slovakia, based on the data we have, is above the EU average, but on breast it's behind. So these are the kinds of pieces of information that can be used to demonstrate where each country sits on cancer inequalities issues. Here we have, for example, nurses, the number of nurses per 100,000 inhabitants being lower than the EU average, and reimbursement of new oncology medicines lower than the European average. Again, this is about trying to look for improvements and measure progress thanks to the Europe's Beating Cancer Plan. What we were talking with the minister about this morning was about the fact that in Brussels, everybody knows about the European Beating Cancer Plan. It's not the same in every country of Europe. And we want to bridge that gap, join those dots, make sure that national politicians and parliamentarians and policymakers and the public know about Europe's Beating Cancer Plan. And what's also important is that we can learn from each other. We can learn from the experience of different countries in trying to tackle some of the issues that exist in reducing inequalities. In some countries, for example, they have very good screening opportunities, but not enough people take them up. Not enough people go to the appointments. In some countries, they have very good HPV vaccination programs, but again, not enough implementation. And as we were saying earlier today, the devil's in the implementation of any public policy issue like trying to beat cancer. So if you've got data that you think should be in the European Cancer Pulse, we'd love to hear from you. We're going to do a version 2.0 this autumn, where we'll be showing updates. And we have this group, the Parliamentarians for Cancer Action, both in Brussels and in national parliaments. And the reason that we think that it's important to have this link between politicians, policymakers, and the data is that the inequalities issue is at the top of, keeps the inequalities issue in cancer at the top of the agenda. And of course, there's three big things that we've identified here which are making the gap a real issue. One we've already talked about, the disconnect between Brussels and the individual countries. The other two we haven't, the impact of COVID, the backlog caused by COVID, people who didn't keep their appointments, who stayed at home and who are now presenting with cancer at a later stage, and Ukraine, the impact of the war on Ukraine with refugees, particularly in countries bordering Ukraine. So we have this vision that the 70-35 vision for cancer, achieving an average of a 70% long-term survival rate from cancer by 2035 across Europe, and the data will help us get there, we believe. These are the parliamentarians, just some of the parliamentarians we have in Brussels and in national capitals working with us. And if you know an MP or an MEP that you think should be in this group, please let us know. We're looking for parliamentarians who support our mission to reduce inequalities in cancer. We have an inequalities network that you can get involved in. This is a network of many organizations you can see on the screen who want to reduce inequalities in cancer wherever they exist. You can get involved. We have a summit in November where we'll be discussing these issues and launching the 2.0 version of the European Cancer Pulse. That's on the 15th and 16th of November in Brussels and available online. And we will be launching a manifesto that members of candidates for the European Parliament can sign up to the manifesto on accelerating momentum in reducing inequalities in cancer. And we're very proud to say that we're launching today a new initiative which is about taking the new EU Council recommendations on lung cancer, on prostate cancer, and on gastric cancer. They're brand new. They were launched, when were they? December last year, I think it was. The EU Council's made these recommendations. They're only recommendations. It's up to each country to decide if to implement them and how to implement them. And what we're launching today is a program where the European Cancer Organization and experts like we have with us here in the room today can assist, can provide case studies, can provide suggestions to individual countries who are thinking about increasing their screening of lung, prostate, and gastric cancer, or introducing their screening of lung, prostate, and gastric cancer, and seeing if we can help them step by step. So I think that concludes what we were wanting to present today. Any questions you may have, please let us know, and we'll have copies of this available at the back of the room. Thank you very much indeed.
Thank you. Are there any questions? There we go.
Good morning, Marcis.
I'm Marcis from Latvia, and
No, you have to just have it close to the mouth. Okay. The closer, the better. Yes.
Actually, my question is, thanks for the presentation. And the question is how you mentioned the complementarity to the European Inequality Registry. How does it go together? How this workload is shared between the PULSE and the Inequality Registry? Thanks.
Very good question, Marcis. There's too many mics here, including myself. Well, the PULSE includes the data from OECD and the Cancer Inequalities Registry. Of course, the Cancer Inequalities Registry has some specific rules around it. It only includes comparable data for all EU 27 countries. So that is included in the PULSE, but what's included in the PULSE is other data too, from other countries and so on. So we have a very good relationship with OECD and the European Commission. I think part of the difference is about making it accessible to the public, making it maybe a little less academic and a bit more presentationally available. But we're all on the same team here as far as we're concerned. It's all one big collaboration. And I think the most important message that we want to get through is that this is a journey that we're all on. It's not about you're right and you're wrong, you're good and you're bad. This is a journey that each country and each region and each city is on to try and improve cancer care for its citizens, and that's something we can only achieve by working together.
Any other questions? Thank you very much. Thank you. So let's continue with prevention and screening, Europe's Beating Cancer Plan, activities and opportunities for Slovakia. Please welcome Daniela Kalajova, Public Health Officer from Ministry of Health of the Slovak Republic, and Torsten Blum, Co-Chair of the Prevention, Early Detection and Screening Network of European Cancer Organization.
Good morning, ladies and gentlemen. I'm more than happy to be here and to see many favorite and famous people here because this is a unique opportunity for us. I am not aware that similar conference has been organized before. We are here together, and that is a sign that we can move and to improve the situation in Slovakia. I would like very briefly to inform you about the activities and actions on behalf of Ministry of Health, Department of Public Health Screening and Prevention. Maybe you are aware, maybe not. EU for Health for the years 2021 and 2027 is a very important health program for every member state in Europe because there is a vision for a healthier European Union and healthier country in the future. Actions fall under 4 strengths: disease prevention, crisis preparedness, health systems, and digital strength, but with a cross-cutting focus on cancer. And this is a unique opportunity for all member states to be better and to implement better. Cancer is one of the major public health problems affecting our society. And the Slovak Republic is committed to improve the organization, management, and the provision of health care. As a part of our National Cancer Control Plan for the years 2021 and 2025, and our role is to strengthen our activities, to cooperate and to develop existing national activities. There is still room for improvement for us. Within the National Cancer Plan, we are in line with European Commission initiatives because we are involved in a PERCH project, what is joint action. And the general objective of PERCH project is to support our efforts to improve HPV vaccination in Slovakia by strengthening joint efforts with other European countries, of course, with aim to reduce incidence and mortality of cervical and other cancers caused by HPV. The aim is to plan and implement HPV vaccination campaigns. There is still a lot of activities we can implement. We would like to improve data and monitoring system on HPV vaccination and HPV screening, because there is a need to put those two issues together in the future, to improve knowledge and awareness of HPV infection and vaccination, and to improve abilities for healthcare providers to be able to communicate with patients about HPV diseases and also prevention. The second very important activity is project with the technical support of IARC for us, for the Slovak Republic, improving cancer care coordination and screening in Latvia and Slovakia. This is a very important project in line with European Beating Cancer Plan. It's funded by the European Commission within the technical support instrument, DG Reform. And technical support is provided by our colleagues from IARC. And this project is implemented with coordination and National Oncology Institute in Slovakia. National Cancer Plan and Council recommendation already mentioned before is something what is waiting for implementation at the national level. So we would like to join to the future joint action led by future coordinator, University of Latvia, with the title of the project, Implementation of Cancer Screening Programs. The focus will be on capacity building, monitoring, implementation of new screening approach presented by Council recommendation from the December last year, and improvement of our existing screening programs. Cancer control needs something more, and shift from the paradigm which could be sometimes limited to healthcare provision only, to be a broader multi-sectorial framework when we are talking about cancer control, to better reflect health as a result, as a public priority, addresses all determinants of health, not only healthcare, and focuses on health as an investment rather than cost, and has an overall impact on the social and economical development in Slovakia. There is a huge opportunity for all of us in this room for further synergies to close the gap between research, policy and practice. Strong governance on cancer control is still missing in Slovakia, and there is no implementation without the strong governance. So we really believe that prevention and cancer control will remain a priority for Slovakia and for the future update of our action plans, and those action plans will be continuously implemented and supported with the aim to improve the health status of the Slovak citizens. Thank you.
Thank you very much. And now Torsten Blum, co-chair of the Prevention, Early Detection and Screening Network of European Cancer Organization.
Dear ladies and gentlemen, dear colleagues, first of all, thank you very much to Onko Alianza Slovensko, I hope I pronounced it correctly, and the Ministry of Health of the Slovak Republic for inviting me, for hosting this event, and also thank you very much to all of you for showing your interest, for being here, and hopefully for promoting better quality in lung cancer care, not only in the Slovak Republic, but all over Europe. My name is Torsten Blum. I'm from Berlin. I'm a pulmonologist by nature, very dedicated to thoracic oncology, and currently my main field is implementing lung cancer screening. The Europe's Beating Cancer Plan is, I think, clearly a powerful tool for all of us within the EU to promote better cancer care throughout Europe, but especially in our individual countries. And two topics are in the EU Beating Cancer Plan on prevention. and also on early detection, namely screening of cancer. In my talk, I will mainly focus on lung cancer screening. We are well ahead of time, so please, after that, let's discuss about initiatives on prevention, because they are, of course, very worthwhile. It's always better to have primary prevention before individuals are exposed to risk of developing cancer. But please, let's not forget about those individuals who have already been exposed, like smokers, which is an addictive disease, because they are now at risk of cancer, and I think they also deserve that their potential cancers are detected as early as possible. I think we are all aware of the cancer screening process within the EU, which led finally to the recommendation by the EU Council, the update of the EU cancer screening recommendations last December. Before that, it was a long political process. First, there was the EU BICA group report approved by the European Parliament. Then, very important, SAPIR, the scientific advice mechanism within the EU, came up with their sophisticated evidence-based report for the 6 cancer screening types recommended in the new recommendations by the European Commission. And that's a solid evidence basis for all the 6 cancer types. The 3 existing ones, breast cancer screening, colorectal screening, cervical screening, but also the 3 new ones, gastric cancer screening, prostate cancer screening, and lung cancer screening, which I like to focus on. In addition, it's not only recommendations, but the EU is very keen that those cancer screening programs are successfully implemented, or if already implemented at the national levels, that they will be improved, that their impact, their efficacy will improve. For the 3 new cancer screening programs, gastric, prostate, and lung cancer screening, there has been, under the EU for Health umbrella, 3 grants issued last year, and the corresponding consortia started this April with these implementation programs. Talking about lung cancer screening, we do know that lung cancer is the biggest killer, unfortunately, within the EU, also within the Slovak Republic. So the most recent GloboCan data tell us that every year about 3,300 patients are diagnosed newly in the Slovak Republic with lung cancer. Unfortunately, about 2,500 will die per year due to lung cancer. But we do know, and there is solid evidence, that low-dose CT-based lung cancer screening will enable us to detect lung cancer earlier and achieve a stage shift from the metastasized stages to the early stages that could be curable. Because nowadays, still, in the majority of European countries, lung cancer is detected late when the disease is already metastasized, when cure is no longer possible. And the idea by low-dose CT-based screening in risk populations on an annual basis will help us to detect this deadly disease earlier so that it can be cured by surgery or other curative means. Based on 10 randomized control trials, the 2 largest one, NLST from the United States of America, and the largest one in Europe, the Nelson study, we do know that low-dose CT-based screening can significantly reduce lung cancer-based mortality. There is also a trend that it can reduce overall mortality in risk populations that are defined by age and also the smoking consumption. And we should be aware that lung cancer screening programs are already going on within the EU. So here in green you can see Croatia. The Croatians were the first within the EU that started a nationwide lung cancer screening program. It's really it's a sophisticated, well-made program with GPs enrolling, motivating people at risk to enter lung cancer screening programs. They most recently presented their 2 years results, which are really promising and go beyond the positive data that we have seen in randomized controlled trials. There are 2 other countries, Poland and the Czech Republic, who have just started national programs last year. All those countries in blue are countries that have already or are currently running pilots for lung cancer screening. And I just heard on the floor this morning that there's a good chance that there will be a pilot on lung cancer screening in the Slovak Republic soon, and I would be grateful to get in contact with those in charge of that. So implementation is already ongoing, and I think it's our task to facilitate these actions, and as Mike Morrissey has said, to come up and to facilitate exchange of knowledge, successes, but also pitfalls to avoid. Lung cancer screening, I think this is also true for the other cancer screening programs, is a complex process. So first, the identification of people at risk and enrolling, reaching out to them is a major step, because as we are aware in many other areas in healthcare, there are definitely hard to reach populations, socially deprived people, migrants, geographically remote cohorts, but we also need to find ways to come up with a structured progress of the original screening process, but also of the workup of the positive or suspicious findings, because one major aim, not only lung cancer screening, is to keep the rate of false positive findings low, because we need to avoid futile invasive procedures which may harm healthy individuals at risk for cancer. This is especially true for lung cancer. On the right sides, you see different points where we have already worked on to come up with effective but also cost-effective programs. We do have already data on successful implementation of lung cancer screening programs. Here you see one paper by Balata on the first results, baseline results of the 5 UK pilots. And they were, like the colleagues in Croatia, also very successful. So the pickup rate of lung cancer at baseline screening was 2%. So if you screen 100 individuals at risk, 2 in the UK were diagnosed with lung cancer. 14 had a shorter follow-up, which didn't prove lung cancer, so they had a shortened follow-up scan after 3 or 6 months, and only 2 had a false positive finding, so were undergoing a futile invasive procedure, but no relevant morbidity or mortality was caused by these procedures. So very successful program. And by implementing structured, rigid, guideline-based programs, I think we are all capable to come up with similar results. I am part, and I'm really grateful for that, of the SOLACE consortium. SOLACE is an EU for Health funded consortium with the aim to improve the implementation of lung cancer screening programs within the 27 EU member states. So our idea is to provide in a toolbox approach advice, but also collecting experience like in the Slovak Republic and of course many other countries, what works good, what hasn't worked good in the past, to provide everybody within the EU good advice how to implement a powerful national lung cancer screening program. And of course, we will also integrate smoking cessation. We will come up with a living guideline on lung cancer screening, which will hopefully set the basis for a EU lung cancer screening guideline. We will have 3 implementation programs, and we are very keen to also set up a pan-European research platform on lung cancer screening around. On the map in green, you can see the countries already integrated within SOLACE, and we are, of course, very, very happy and looking forward to collaborate with the Slovak Republic. There are 4 medical societies involved: the European Respiratory Society, the European Society of Radiologists, the European Society of Thoracic Surgeons, the European Radiotherapy Society, 2 patient organizations, European Lung Foundation and Lung Cancer Europe, and all is under the umbrella of the European Cancer Organization, which helps to coordinate also the 2 other EU health consortia, which I will talk on later on. Yes, we are ready to implement lung cancer screening in Europe. For me, there is no doubt. The programs are evidence-based. They could be effective. Harms, I think, could be reduced to a tolerable level. We already have evidence that most programs are cost effective. And let's not forget, it's about the individuals at risk for lung cancer. It's not only politics and bureaucracy. And now speaking in a much broader sense, yes, we do need to improve lung cancer screening in Europe. I think that's one of the main tasks within the EU Beating Cancer Plan, because many individuals have already been exposed to risk factors for cancer. We do need to improve the 3 existing cancer screening programs: breast, colorectal, and cervical cancer. I think we are also do need to implement or help to facilitate to implement the 3 new recommended cancer screening programs. So it's not only SOLACE on lung cancer screening, but it's TOGAS on gastric cancer screening. It's PRAISE-U on prostate cancer screening. And I think we are also obliged to invest in research to explore future cancer screening options. Liquid biopsy probably will be one. It's not ready for prime time yet, but we have to work to find and maybe combine it with the existing screening programs to make them even more effective. And of course, artificial intelligence is another powerful tool that we need to work upon. So in summary, the evidence justifying to start implementation is there. We have the solid basis, the cancer screening in the European document by the Scientific Advisory Mechanism, and from ECO, the European Cancer Organization, we would like to highlight that we have a lot of focus topic networks, and I think the aim of the game is to link cancer screening within the entire cancer screening pathway in a meaningful way, because that's a good way to really take care of individuals at risk for cancer. Thank you very much, and now I'm really looking forward for a fruitful discussion.
Thank you very much. Torsten Boom, are there any questions for Torsten? Thank you.
Dr. Bendova, Slovak Society of General Practitioners. Thank you for your presentation. I've got two questions regarding the lung cancer screening. First, how do you want to reduce the overdiagnosis, the case of false positive cases? And the second, you mentioned that in Croatia, GPs are involved in the cancer screening already. I'm interested how, and if also in Czech Republic and Poland in these pilot projects, are GPs somehow involved? Thank you.
Thank you.
Yeah, thank you. Both are two important questions. So overdiagnosis is maybe the biggest harm within lung cancer screening programs. So overdiagnosis means we do diagnose lung cancer by screening in individuals at risk, which will not benefit from the therapy of lung cancer. These are especially individuals that are older or have substantial comorbidities. So our aim is when we enroll individuals that we have to check for the fitness, not only for lung cancer screening program, but for the fitness for a curative therapy. So in the US, the age range has expanded from 75 to 80 years. So you should be careful when expanding, for example, the age range to higher ages, because when including older individuals, if they are not fit enough, there is a high risk for overdiagnosis. The same is true for individuals with, let's say, a high burden of comorbidities. So there should be qualified healthcare professionals at the entry into a program, just verifying that an individual is really fit and suitable for a program, taking into mind to avoid overdiagnosis. For the second questions for the GPs, so I think there are already two good examples. So one is, as you said, Croatia. So I'm close contact with Miroslav. I cannot pronounce his last name, Samarancha or something like that. I'm sorry for that. So I know Miro quite well, and he is really grateful for his powerful GP network in Croatia because they ensure a high enrollment rate. And I think that's the most, or one of the decisive factors in lung cancer screening program to identify and motivate people to start and to go in the program when at risk and suitable for the program. Estonia is another good example. They had a pilot that was also GP-based in terms of an enrollment, and they have had even higher, let's say, enrollment rates than Croatia, something like up to 80 of 90%, so very successful. In Poland and the Czech Republic, I think that they also will build upon GPs for enrollment, but they will also build upon secondary care physicians like pulmonologists, other internal medicine specialists. And I think at the aim, we need to come up with multiple channels that identify, motivate, and help to enroll individuals at risk. So, for example, this could be ambassadors for migrant populations. This could be occupational medicine specialists for workers, at least in Germany, who usually do not see any GP or other physician at all. So we need to be creative, and I think that's also a good example how we could learn from each other within the EU by just exchanging knowledge.
Thank you very much. Another question?
Thanks. What I wanted to ask is, do you have a mechanism of involving also other countries that are not a part of SOLACE to the SOLACE activities? And if so, what you are offering on behalf of SOLACE? Is it protocols? Is it recommendations? Thanks.
So first of all, we are very open to actively integrate as many EU countries as possible. So a first step will be to reach out via the national societies to set up, we will call it national expert teams that help to promote lung cancer screening implementation within their respective countries, but also to have an active knowledge exchange, to learn about the national status quo of the respective countries, but also to provide assistance, as said, in a toolbox approach, how to better implement, like in countries like in Germany, where we are just, let's say, have the bureaucratic hurdle that needs to be solved. So yes, we are open. What will we provide? So we will have a knowledge hub that will be freely available. Online, we will provide an evidence-based lung cancer screening guideline that we will, of course, offer to the EU cancer screening guideline, so that hopefully it will take not that long to come up with an EU lung cancer screening guideline.
Thank you very much. Any other questions?
I see the quitting the smoking as a huge challenge within the lung cancer screening programs. Could you please share with us some experience from other countries? Who is responsible for this building block in a screening program? Because we see this in Slovakia as a huge challenge for the future.
So first of all, integrating smoking cessation within lung cancer screening program is a win-win for both. For the lung cancer screening program, because it will become more cost-effective, but also for smoking cessation programs, because we do know that the willingness to quit smoking is much higher when we are within a lung cancer screening program than in individuals that are offered a standalone smoking cessation program. To my knowledge, the current status of smoking cessation programs within the EU is very heterogeneous. So, for example, in Germany, individuals have to pay at least a part of the amount. The other part is funded by insurance companies, mostly run by outpatient pulmonologists. But it's different in national healthcare systems like in Denmark or in the UK, where it's offered by the national healthcare system. So very heterogeneous situation, but we do know, for example, out of the pilot that it's possible to successfully link or integrate smoking cessation within the pilots.
Thank you. Any other questions? I think we can wrap up. Thank you very much.
Thank you.
Thank you, Torsten. Now we will continue after a short coffee break. Stefan Koretz mentioned that the networking part is equally important than the expert part. Please note that when you come back after the break, we will have expert panel in Slovak. So if you don't understand or do not speak Slovak, please take the headset when you come back. Thank you. See you in 20 minutes.
Thank you for the invitation.